Hi, it's Darren Chang with Great Nation Insurance, and today we'll be discussing Medicare Part D, the different stages as you go through Part D, and what you can expect your out-of-pocket to be as you go through these stages, and what's applied towards your max out-of-pocket until you finally hit the last stage. Stay tuned, it's coming up next. Okay, let's begin. This is Darren Chang with Great Nation Insurance, and today we're discussing Medicare Part D. We're going to go through the different stages. Now, some of you may go through all these stages enrolled in a drug plan. Some of you may not go through all these stages, but we'll at least look at all the stages and know how they all work. Okay, there are 4 stages of a Medicare Part D. The first stage would be your deductible stage, and then the second stage would be your initial stage. The third stage would be your coverage gap stage, and then the fourth and final stage would be your catastrophic stage. Okay, let's start with stage 1, which is the Medicare Part D deductible. This is the amount that you will pay each year for your prescriptions before your Medicare drug plan pays its share. Deductibles vary between Medicare drug plans. No Medicare drug plan may have a deductible more than $445 in 2021. Some Medicare drug plans don't even have a deductible. Now, I've seen this a lot in Medicare Advantage plans, the Part C of Medicare, which include a prescription drug plan. Usually those plans I've seen have no deductible for the drugs, $0 deductible. Now, on the standalone drug plans that you enroll in, if you're on original Medicare, I have seen deductibles lower than $445. Then I've seen deductibles that are $445, but they're not supposed to be more than $445 in 2021. So all drug plans have a cap on their deductible, and that cap is $445. Now, in this stage, you will pay the entire cost of the drugs until you hit that deductible. Once you hit that deductible, then you'll move into stage 2, which is your initial coverage stage. Stage 2 is the initial coverage stage of Medicare Part D. These are the amounts you pay for covered drugs after the deductible, and that's if your plan has one. You pay your share and your plan pays its share for covered drugs. If you pay coinsurance, these amounts may vary throughout the year due to changes in your drug's total cost. The amount you pay will also depend on the tier level assigned to your drug. Now, if you get prescribed a medication and it's a tier 3 drug or even a 4 or 5, the higher the tier, the more expensive it's going to be. So always keep that in mind. Even with a drug plan, it's going to be expensive. Once you and your plan have spent a combined total of $4,130 on drugs, and this is including the deductible that you had met in stage 1, you'll enter stage 3, which is the coverage gap, also known as the donut hole. Stage 3 is the coverage gap of Medicare Part D. Most Medicare drug plans have a coverage gap, also known as the donut hole. This means that there's a temporary limit on what drug plans will cover for drugs. Not everyone will enter the coverage gap. The coverage gap begins after you and your drug plan have spent a certain amount for covered drugs. Once you and your plan have spent $4,130 on covered drugs in 2021, you're in the coverage gap. This amount may change each year, and also people with Medicare who get extra help paying for Part D costs won't ever enter the coverage gap. What's important to know about this stage is that once you enter this stage, you're starting from $4,130 and working your way up on your out-of-pocket expense. So the next slides are going to show you basically brand name drugs and generic drugs. It's going to show you how much you're going to pay, how much the manufacturers are going to pay. It's going to also show you how much your plan's going to pay and how it's all applied towards that max out of pocket in this stage of the coverage gap, starting from that $4,130. Okay, so let's talk about brand name drugs in the coverage gap stage. Once you reach the coverage gap, you'll pay no more than 25% of the cost of your plan's covered brand name prescription drugs. You'll pay this discounted rate if you buy your prescriptions at pharmacy or order them through mail. Some plans may offer you even lower costs in the coverage gap. The discount will come off the price that your plan has set with the pharmacy for that specific drug. Although you'll pay no more than 25% of the price for the brand name drug, almost the full price of the drug will count as your out-of-pocket cost to help you get out of the coverage gap. What you pay and what the manufacturer pays, which is 95% of the cost of the drug, will count towards your out-of-pocket spending. So below is the breakdown. Now, if you look here, of the total cost of the drug, the manufacturer pays 70% to discount the price for you. Then your plan pays 5% of the cost. Together, the manufacturer and the plan cover 75% of the cost. You pay 25% of the drug. There's a dispensing fee. Your plan pays 75% of the dispensing fee, and you pay 25% of that dispensing fee. What the drug plan pays towards the drug at 5% and the dispensing fee of 75%, they are not counted towards the out-of-pocket spending. So on the next slide, you'll see an example of this. Okay, here's a brand name drug example while you're in the coverage gap stage of Medicare. Mr. Jones reaches the coverage gap in his Medicare drug plan. He goes to the pharmacy to fill a prescription for a covered brand name drug. The price of the drug is $60, and there's a $2 dispensing fee that gets added to the cost, making the total price $62. Mr. Jones pays his portion, which is 25% of the total cost. That equates to $15.50. Now, what Mr. Jones pays, which is $15.50, plus what the manufacturer discounts off the drug, which is that 70% of the cost of the drug, that equates to $42. Now, if you add up 42 and $15.50, it comes out to $57.50. Now, that total amount there is what counts towards the out-of-pocket spending that helps Mr. Jones get out of the coverage gap. Now, the remaining $4.50 is paid for by Mr. Jones's prescription drug plan, and that will not count towards getting Mr. Jones out of the coverage gap. So remember, in this example, basically, if you're the insured and you are in the coverage gap right now and you're getting a brand name drug, just remember that what you pay, your 25% that you pay, plus what the manufacturer discounts off the drug counts towards the out-of-pocket max in this stage. And remember, you're starting that amount from $41.30. You're picking up where you left off in the initial stage, where that $4,130 was. And now you're starting to add these new amounts. This 57 gets added on top of that. And you're going to have to basically reach $6,550 in 2021. That's the amount that is the coverage gap max. And once you hit that amount, then you'll move to the last stage. Now, the next slide is going to show you an example of the generic drug. Okay, for generic drugs, while you're in the coverage gap stage of Medicare, just remember that Medicare will pay 75% of the price for generic drugs during the coverage gap. You'll pay the remaining 25% of the price. The coverage for generic drugs work differently from the discount for brand name drugs. For generic drugs, only the amount that you pay will count towards getting you out of the coverage gap. The next slide will give you an example of this. Okay, here's the example of the generic drug while you're in the coverage gap stage of Medicare. Mrs. Johnson reaches the coverage gap in her Medicare drug plan. She goes to her pharmacy to fill a prescription for a covered generic drug. The price of the drug is $20, and there's a $2 dispensing fee that gets added to the cost. Mrs. Johnson pays 25% of the plan's cost for the drug and the dispensing fee, so that equates to $5.50. The $5.50 she pays will be the only amount that will be counted towards the out-of-pocket spending to help her get out of the coverage gap and into the next stage, which would be the catastrophic stage. Okay, before moving to stage 4, which is the catastrophic stage of Medicare Part D, know some things that'll help get you out of the coverage gap stage and into stage 4 so you can start paying the least amount for your prescription drugs. Now, the things that will count towards getting you out would be your yearly deductible, your coinsurance and copayments, the discount you get on brand name drugs while you're in the coverage gap, and what you pay while you're in the coverage gap. Those will all get you closer and closer to stage 4, which would be the catastrophic stage. Now, the things that don't count towards getting you there is your monthly premium that you pay for your drug plan towards the insurance carrier, and the pharmacy dispensing fees don't count, and what you pay for drugs that aren't covered under the drug plan. So if the drug is not on the formulary list of the plan that you're enrolled in, unfortunately, it will not apply. Stage 4 is the catastrophic stage of Medicare Part D. Once you've spent $6,550 out of pocket in 2021, you're out of the coverage gap stage and into the catastrophic coverage stage. It assures that you pay a small coinsurance percentage or copayment for covered drugs for the rest of the year. Now, plans will vary on how much you'll spend, but approximately it's about 5% of what you will spend in this stage. Okay, to end, I'll remind you that the 4 stages that we covered will repeat starting January all the way till December. So if you're on the deductible, just remember it's in January, and the catastrophic coverage ends in December, and this process just keeps repeating over and over. Well, I hope this information has helped you. If you have any other questions or maybe something didn't get answered in this video, you can shoot me a text or give me a direct call right here at 918-398-0104. You can also email me at darren@greatnationinsurance.com. Feel free to visit our website at greatnationinsurance.com as well. Thank you so much for watching, and I hope you have a great day.